An important part of our pandemic reflection is to go back to decisions that were made and try and see whether or not they were actually based in a good scientific approach to what was done. Many people don't want to acknowledge that a lot of the actions that happened around the pandemic were based around two things: a poor understanding of the science of severe COVID 19 and fear. And they were afraid because they didn't understand. And so the first thing to acknowledge is that there was poor understanding. And even with that, though, there were some very obvious things, especially with regards to kids, which is where I'm going to be focusing on a Denmark study with regards to adolescent teens. And this study was healthcare use in 12 to 18-year-old adolescents vaccinated against COVID, SARS-CoV-2 versus unvaccinated in a national register based Danish cohort. Important to note that this study was published in January, but it's locked. You can't get access to it unless you're going to pay. And so I'm using another study, which I'll come to in a little bit, based around the same cohort of kids. This is the kind of study that we need to be able to try and understand whether or not the right thing was done. Some people find it inconvenient to ask these questions, but if we don't ask them, there's a very good chance that if something similar occurred again, the same mistakes would be made. This is part of our learning. And so when we reflect carefully on who was at risk for severe COVID 19, if you can remember all the way back to 2020, it certainly wasn't kids. It was older people, high risk comorbidities. Hypertension stood out as one of the main ones. Diabetes, kidney disease, obesity was a contributing factor to slightly younger people, and eventually interferon autoantibodies was another big factor. So age was one of the biggest risks, and kids weren't really at significant risk. And the only reason they were locked up with the lockdown was to protect grandma from them giving it to her, not because anybody was concerned about them getting it. Just a reminder. So, therefore, why were they vaccinated? That was the question I asked at that point. I was saying, well, what are you doing? We using a new technology. They are at very low risk, if any. Why are you giving them a vaccine when you know, or you should have known, that it only had limited impact on transmission? Some people say it had some impact, so it was worth it. I'm thinking, no, just because something has some, even a small benefit, doesn't mean you use it broadly on everybody. That's just not how medicine works. So let's get to what this paper showed us. So, as I said, I had to go back because there was a related paper from the same authors that was done in 2023 that is more open. And this one was looking at symptom specific hospital contacts in 12 to 18 years old vaccinated against COVID 19, a Danish register based cohort. And so this was openly available, and this is why I was able to look at it in far much more detail. And they were specifically following 12 to 18-year-olds in Denmark, looking specifically at the Pfizer vaccine, the BNT162b2 COVID 19 vaccine. And they were comparing the vaccinated to the unvaccinated. You know, I keep on asking why this kind of research is not being done more. It is so important because you won't, well, unless you don't want to understand, but if you do want to understand, this kind of information is absolutely critical to helping us to understand more about what is going on. So they looked at a short period of time, about 6 months, where this was between May and September. Symptoms of the hospital contacts using these codes. I'll come to that in a minute. And what they found when they looked at the cohort, monitoring them for 6 months, they found that unspecific cognition symptoms may be important to monitor in vaccinated girls, and likewise throat and chest pain in vaccinated boys within the first months post vaccination. I'll come to the details on that in just a minute. But the first question, as I said, is were they an appropriate cohort to target in the first place with regards to the vaccine? And the paper does ask that question as well. It has it here. In healthy adolescents, SARS-CoV-2 infection is predominantly mild or asymptomatic. Thus, the need for vaccination at an individual level is debated. They did mention, however, that severe illness may occur in adolescents with an underlying medical disease. That's a very reasonable argument. If somebody has a comorbidity, whatever their age, it's reasonable to consider that they could have been vaccinated. Now, it's important to note many people um, are looking at what happened then based on what we know now. But at that time, there was still a lot of fear. And so many of the actions that existed at that time were based around a limited understanding of the science. However, as I said, we had enough data that we knew that the kids were not really at high risk. So I never could understand why they were then put as a target in order to vaccinate them. But that's just my opinion. The This study was a large study. They looked at about 100,000 kids in Denmark. And the majority of them, when you looked at the numbers, I think the majority of them were Danish in terms of their citizenship. This is what it looks like here. So Danish was 92.8% of them were Danish. Um, this is the unvaccinated versus the vaccinated group. Um, and most of them, they were almost equal between boys and girls. And they broke it down based on their educational levels, their annual family income, and so on. And you can see that the vaccinated cohort, 41% of them were in the higher income family groups. And all of these things probably fit in with the fact that that was where the push mainly occurred at that time. So it's valuable information that they found. Now, when we look in more detail at what happened in terms of the outcomes of what they noted, and I've got a table here that will help you to see a little bit more about what they did, what they looked at. Here is the diagnosis with boys. They looked at the first section, 0 to 56 days after their second vaccine dose. Anything that is above this line here, this dotted line, means that it's higher in the vaccinated cohort. Anything below that means that it is higher or lower in the vaccinated cohort. So in boys, in that 56 days, they were more likely to have a cough and some pain in the throat and the chest. Now, they've highlighted in this that this could have been related to the myocarditis or pericarditis as being a symptom, which was much more frequent in boys than in girls. A lot more had a fever, not surprising, and a number had some fatigue. And what stands out in the boys is enlarged lymph nodes. This was significantly increased in the context of the second vaccine dose. It was one of the things that we had noticed, hypermetabolic lymphadenopathy, where the lymph nodes light up, and people who were having cancer screening with a PET scan couldn't have it within 3 months because it would confuse the diagnosis as to whether or not they had cancer spread. So this was quite a significant thing, and it has gone under the radar, the significance of it. But we will. It's another thing that needs to be better understood. The other point that they had was they had nausea and vomiting here, and I'll go through the ICD codes in just a little bit. And for girls, the standout thing here was syncope in the first 56 days. They were more likely to have fainting episodes. And beyond 57 to 182 days, the standout problem was dizziness and giddiness, really significantly higher in the girls. You'll notice that many of the other things like pelvic pain, skin rashes, cough is lower in the vaccinated cohort. There's no clear reason why that is the case. And this is where I talk about the non-specific effects with regards to the vaccines. And this is why you have to be careful, because we don't fully understand, one, why it causes these things, and is it just a short-term issue or a longer-term issue that we're looking at. So when we look at the breakdown for the ICD codes for what happened with girls, and ICD codes are symptoms or diagnostic codes. So it just makes it easier when you're doing an analysis of what has happened across a large cohort of people. If they have a code, it's easier to then put them in buckets. And so you know whether or not somebody had a pneumonia, or if they had a UTI, or whether or not they had a heart attack. Each one has a different code. And the code that stood out here with regards to girls specifically was the ICD 10 code R41.8, which means other and unspecified symptoms and signs involving cognitive functions and awareness. And it usually means when a person is just having a problem with thinking, memory, but there's no specific diagnosis like dementia or delirium or a psychiatric disorder. They're just a little bit foggy in their brain. And this is sometimes what we get described with people who have long COVID type symptoms. And when you break it down even further for the vaccinated girls in the days 57 to 182, trouble concentrating, difficulty finding words, minor memory lapses, alterations in awareness, feeling a bit out of it, mild confusion, slower mental processing, feeling mentally fatigued, struggling with mental multitasking. And you have to remember that these symptoms are not just random symptoms. These are symptoms that were enough for them to seek help from the medical system. This is why it got coded. So they would have gone to either their clinic or their doctor saying that they have got these symptoms. What is going on? And it wasn't just a minor change, it was a significant change. And based on some of the research that I'm looking at around what happens in long COVID, and I'll be talking about this soon, I really am beginning to zone in on the fact that it seems to be primarily brain stem related disease. That's the connection between the brain and the spinal cord. That area is the brain stem. And any inflammatory processes affecting that can have a wide range of cognitive symptoms. And this is why I think that that is so important. For the boys, it was a little bit different. Their primary ICD code, R11, was nausea and vomiting. And it is really to classify complaints, as we said, nausea and or vomiting, isolated or combined with no specific disease. So they haven't got a diagnosis of appendicitis, which has a different code, or food poisoning, which has a different code. And so it's just generally nausea and vomiting with no specific cause that was determined. Could be stress related, functional. We don't consider it to be necessarily very serious. And again, it's a question, well, why would they have more of these symptoms? One of the lessons that I've learned from a clinical point of view, don't ignore anything. Even if it doesn't seem to make sense, we should understand what is the mechanism. Why would it occur? Why would it have a higher risk? And this is up to 6 months after they had been vaccinated. It's not to be ignored. And this is in more detail. It could represent gastroenteritis, food poisoning, migraines, anxiety, or stress, and just rare things that were not coded. It's just random stuff. As to why it's affecting boys more than girls, it's not clear. But the two things that I've noticed, and as I think about it now, the two bits here, one, the nausea and vomiting, Combined with lymph node swelling, I'm beginning to think that if this pattern occurs within the intestine, so you have mesenteric lymph nodes, it could present with this kind of symptom. Because one of the mimics of appendicitis is mesenteric adenitis, which is inflammation of the lymph node close to the appendix. And so, quite logically, if you're seeing that kind of pattern with nausea and vomiting, this may represent a similar kind of thing with inflammation of the lymph nodes inside the gastrointestinal tract. So that would make sense, and that would probably be a useful explanation for this. In summary, as I come to the end of the presentation as to what they spoke about in the discussion, just highlighted a few things here. As we said, higher rates of abnormalities of breathing and non-specific cognitive symptoms. The boys had a higher rate of nausea and vomiting, but lower rates of non-specific cognitive symptoms. And this was the first study ever, and this was 2023, to explore symptom-specific hospital contacts in adolescents following vaccination using national real-life data. So this kind of study is what we need now to be able to try and understand a little bit more about what is happening. One more final point on it is that pain in the throat and the chest could reflect non-harmful pain during a viral or bacterial infection. However, it could be a sign of perimyocarditis, which is a much higher risk in boys as opposed to girls. And their symptom presentation may not be as straightforward as having chest pain, like what we're used to seeing. And so it raises the point that we could have been seeing much lower rates of myocarditis because the symptom pattern didn't fit what we would expect clinically. The overall point is that, from my perspective, it appears that if healthy young adolescents with no comorbidities were at extremely low risk of severe COVID-19, none of them got hospitalized. None of that big cohort of over 100,000 kids were either hospitalized or died from COVID. How do you justify putting them in the line? Because in effect, what you're saying is that the only thing that can happen is that they have no issues from the intervention, because they're limited. The benefit is so slight, if any, that it means you have to have gotten it perfectly in order for you not to be doing harm. I can't understand the thinking, quite truthfully. And in time, I'm sure the scientific community will have to justify if we find out that there are longer term issues that these children would get that could be linked in the future with regards to vaccination. How they will justify that scientifically, I understand what we've seen with the studies and the risk support around multi-systemic inflammatory response. But as I said, that risk is so low. In 100,000 kids in Denmark, literally none of them were hospitalized, whether they were vaccinated or unvaccinated. That is extremely important for us to reflect on. There are many challenges to come in time, but we still have to ask the hard questions. And we have to go beyond just the papers showing us all the wonderful things and look long term at some of the hidden issues that are not so easy to find. Thank you.